Hola, sweet friends. Welcome to Love Lab MD, the only place for highly ambitious women to be our authentic feminine selves while discussing intimate relationship topics. Love Lab MD is a non-judgmental space to seek and give relationship advice and power couple tips. We will learn how to authentically lead with love so that we can deepen the connection and enhance the intimacy between our love and ourselves. And I am your host, a doctor mom in a dual physician relationship and a marriage and intimacy coach, Dr. Kate Mangona. Bienvenidos. Okay, welcome everybody to the show. I am so excited to introduce to you one of my new friends. I just met her. We connected on a physician Facebook group, Dr. Chrissy, and she's going to tell us how to pronounce her last name. Dr. Chrissy is a trauma surgeon and a clean living coach. She is the founder of the Whole Body Optimism. She empowers healthcare professionals to transform daily fatigue into lasting energy and vitality. Clean living starts here. And I can't wait to find out more. And she's also the loving wife, and we'll have her discuss her whole love journey soon. She's recently been on social media, so she's new to the scene here. And I just love looking at her Instagram because she's talking about plastics and growth mindset and some alarming female surgeon truth. I just love, watching you on Instagram, Chrissy. So why don't you go ahead and let us know, is there anything else that I left out of your introduction?
No, I think you nailed it all right. I still work part-time as a trauma surgeon, and actually in the next few months, I'm going to be phasing into this new job opportunity. And I know we had talked briefly before about you're 70% clinical, and I'm actually 67% clinical. So almost the same as you. I know, isn't that so strange? And I did this primarily really to work more on my business, because this really was, just pulling at the heartstrings of everything that I wanted to do for people, is really open their eyes to see, how can we live a cleaner life? Is it, the things that we're telling our minds? Is it what we're doing with our bodies? Is it how we're interacting with people? How can we clean up these routines? And not just this metaphysical, like, oh, let's make cleaner living, but no, like practical things like, yeah, don't use plastic cutting boards, because you're cutting directly into that, and that is going directly into your food. You're eating it. And now we're finding that there's plastics in the carotid artery specimens that the surgeons are finding. So it's just, and not this, that they're finding them, they're finding that you're at increased risk of all-cause mortality, strokes, MIs after your surgery, when they find out these microplastics in these specimens. So it's not that just they're finding them and they're getting into our bodies, but when you have them more so at a higher level, then you're at risk for higher complications. Okay. So, and not to mention, like the whole reason why I got into this was my husband and I went through the infertility journey. And when we got married, we started trying to conceive, and we've been doing this for over 4 years now, and have done the IVF route and all these things. And really, you just, as a type A physician, surgeon, like all you want to do is read, like you want to know, how can I change this? We're just perfectionists, and we've gotten this career, we've gotten like now married, I have a house, like you set these, as you say, expectations so high. And now we're at a point where we cannot succeed. And it was a really hard part in our lives for us is, we're doing all these things. Yeah. We're like, what else can we be doing to have this baby? And so this is when, I hired a fertility coach. I, really took a deep dive into how can I clean up my life to make it where I am receiving these children in a more productive way.
Mm-hmm.
And I started noticing, like, oh, I'm, still using K cups, and using plastic, things, especially at work. At work, it makes it so easy. You just go to the coffee machine, like put the K cup in there, and you're ingesting plastics. Am I eating things that have inflammation in them, inflammatory oils, processed foods, things like that? And again, at work, it just makes it easy because that's what's in the doctor's lounges.
Mm-hmm.
That's what's available to us. And what I really had to look at was, how can I make changes that are sustainable in our life? And how can I package this into something where I can teach other people that this doesn't have to be hard?
Yeah.
It doesn't have to be time consuming. It doesn't have to be expensive. And it can be easy to do once you set your mind that you want to do these things in your life.
Yes.
And so, that's whenever I created Whole Body Optimism, which is, to me, whole body and optimism, because I like to call myself a delusional optimist because, I just think that if you're not thinking that way, then you have some limiting beliefs. And it really is cleaning up your mind, your body, and your soul.
Mm-hmm.
And I make these pillars in my program, and it has, a lot to do with physical health, emotional and mental well-being, really focusing on work-life harmony and setting up those boundaries. And that was a big part of me leaving academic medicine full-time,
Okay.
was a boundary for me on where am I going to, bring my energy? Am I going to take it to a place where I cannot reach the maximum amount of people? And I really felt like I was like the door was getting closed and another one was opening. And I had to realize that I needed to place a boundary on where I put my energy at.
Got it. Okay. So you left academics, and then where do you work 67% now?
Well, I just recently took a job in Nebraska.
Okay.
And so we're moving up there, and I'll be a trauma surgeon at a level 2 center. And so and in the transition over the last 2.5 years, I have backed off of, academic medicine, and I was really only there half time.
Okay.
And I was doing locums.
Okay.
And so I was doing locums in the Charlotte, North Carolina area. And what I did was I realized, you know what? Like, I can do this. I can be in a place where I really enjoy practicing medicine there still and start building my business. And so over these last 2.5 years, that's what I've done. I've tried to make this transition. But the problem with locums for me was, and it kind of gets into cleaning up your sleep habits, your physical routines. And I did love locums. I found some really incredible people doing, working in smaller community, like super need hospitals that need general surgeons there. But I really wanted to be in a bed every night that I had my pillow. I knew what my mattress felt like. I knew I can carry all my clean soaps, my olive oils, my avocado oils, my clean ingredients. Like, I had a kitchen that was stocked with the things that I can actually feed my body with and know that I'm having the best, most clean, nourished environment so that I can provide that to my patients at the hospital. So that's how I transitioned over to being like, okay, well, let me just take a more of a kind of full-time, part-time position at a place where we're only going to be in 2 places. And that's going to be Nebraska and down south here. So, so that's sort of why I made this transition, and I kept the door open. A lot of people are like, why'd you go to Nebraska? Well, I just felt like the door had been open there, and the energy was pushing in that direction. And, everybody there seems very nice. And I really felt like I could make a difference there in their work environment.
That's amazing.
Yeah.
Okay, so let's go back. Tell me, how many years have you been married?
So we've been married in December. It was 4 years.
Okay. And how did you guys meet? How did you fall in love?
So we fell in love because, so our good friend, it was a mutual friend, Jessica. She actually, her dad met my husband at this like Pensacola air show one day. And my husband only went up to talk to him because he had an LSU flag waving. And as
Okay.
you don't, I mean, you're in Texas, you know, college football is a big thing. And
Yes.
if you see someone in Florida that has an LSU flag or LSU paraphernalia of any sort, they're probably your people, you know? And so they naturally became friends and started talking. Well, Dr. Dave is Jessica's dad. He was like, "Oh, well, my daughter just moved back to New Orleans. Would you mind taking her out?" And he's like, yeah, sure. Give me her number, you know? So he gets back to New Orleans. He calls Jessica up and he's like, "Hey, I met your dad and he wants me to take you out, you know?" And so they actually went out, but then they just decided to become platonic friends. And that was a year before we even met. And so Jessica and I became friends. And Jessica, we were throwing this big New Year's Eve party. And they tell me, "Hey, Chrissy, we think we want to set you up with someone." And I'm like, "Whatever, just invite whoever. Like, I'm single, ready to mingle, you know?" And so Jessica invited Jay, my husband, to come to this party. And of course, we get to the party and it's like 11 o'clock and Jay is still not there. And I'm like, "What is this guy trying to do?" You know? And so he finally shows up at 11:30 and you know, like it was New Year's Eve, you know, like 11:30 before midnight. We can all know how many drinks we've had, you know, like and so I meet this guy like almost two sheets to the wind, you know, like and I'm just like, "Who are you?" You know? And so we got along that night, but like it wasn't like we had this like huge spark, you know?
Okay. Okay.
And so then he walked me home and everything and we exchanged numbers and he ended up taking me out a few weeks later. And when we were both at dinner, it just kind of clicked for me. I was like, "This guy's my guy." And I literally a week and a half after we met or so, I was like, "This is the guy that I'm going to marry."
What? So did he know too?
Oh yeah, he says he knows, you know. And so like 1 month after we met, which okay, that was New Year's, and then my birthday is February 1st.
Mm-hmm.
He came to my family birthday dinner with my mom and my brothers and their wives, and it was just natural. It was just like you know, he's a Southern guy. He likes to hunt. He likes to fish. So my brothers were eating it up, you know. They
They
just
all like to hunt and fish.
love it. Okay.
Okay. Okay.
And so we just had the best time. And by Mother's Day, you know, first weekend of May, we were engaged.
Wow.
Yeah. And then, you know, like all my friend group, they were Jessica to this day is like, "I'm the matchmaker," you know. And I was like, "Yeah, you know, like we give her thanks all the time. She was in our wedding." And it's just I've never had any second thoughts about, you know, why I married this guy or anything. And ever since, you know, that day. So of course we've had up and downs and you know, through the fertility journey, it's made us really, you know, I'm so grateful for the fertility journey because it's made us stronger as a couple.
Tell us. Yeah, tell us like what advice would you give other people? And it doesn't even have to be necessarily fertility, like if people are going
Sure.
through fertility, but just any hard times. Like what have you found has worked for you and how could this help somebody else who might be struggling right now?
Sure. So I would say, you know, I did this TEDx talk at Tulane, and the keynote. I was not the keynote speaker, but the keynote speaker said something that really resonated with me and stuck with me for a while. And he said, and he kept repeating this: "This is not happening to you; it's happening for you." This is not happening to you, it's happening for you. And, I intuitively knew that. I knew that things were happening in my life for me. But on a daily basis, I repeat that to myself. And I really do think that when you put meaning to suffering, your life changes. When you feel yourself identifying and saying, I'm suffering in something, but you actually put meaning behind it, then it has a purpose. It has a function in your life. So you no longer have to be almost sad and like stay in that suffering. And I really had to, take a step back, and I would give this advice to anybody is when you're in a difficult situation, you're frustrated or something, first I want you to ask yourself, am I dying? If you're not dying, then you really need to pause, like put the brakes on, really look at the big picture and think about, how is this happening for me? How are the winds changing and the circumstances changing so that like our life together, me and my husband, our lives are going to benefit from this? Because it is. There's always a benefit. There is always. Even in those times of suffering, there is a chance for awakening.
I love that.
And, I think a lot of my mindset shift has been, of course, there's a lot of teachers in this. And my coach, Roseanne Austin, fertility coach, has been really instrumental in changing my life in this. And she said this to me during a call, and it really changed sort of my direction in my life about 2 years ago was, Chrissy, what are you tolerating? And I really had to think about that for a long time, because I was like, tolerating? I mean, I do everything, like I'm not stressed out, but what am I tolerating? Like, why am I choosing to tolerate things in my work or in my everyday life or in my living conditions? And why am I not choosing to thrive? Because you know what? We have the autonomy to choose. And I think a lot of people don't think that they have a choice to be happy or not.
Right.
Whenever they absolutely do. You have a choice. You wake up every day. You can make a routine in your life that will give you happiness or not.
Absolutely.
And the foods we put in our body, the things that we surround ourselves with, those all impact. It's like, how many pennies make $1? You may not think 1 penny will make $1, but in the end, when you're doing all these additive things in your life, you're going to get that $1.
Right. Oh, absolutely. Yeah. Who picks up pennies off the floor anymore?
Exactly.
I'm the only person.
I love that. Pick up the pennies.
Oh my gosh. Okay. So what am I tolerating? Why am I choosing not to thrive? And I love how you said the suffering piece. Now, Tony Robbins says this thing that reminds me just of what you said. He says, we all experience pain. Like pain is inevitable.
Yep.
Inevitable. But suffering is a choice.
Yeah.
And that's basically what you said, because you're saying, like, if you put meaning to suffering, it's not suffering anymore.
Correct.
It's your awakening. It's helping other people and their awakening. Right.
It's really, it's a spiritual practice is what it is.
Yeah. I love it. And so can you tell us a little bit about your partner and how your coaching journey, because I know this all started because of your fertility journey, affected him as well? Like, did he get a fertility coach, or is it your journey became rubbed off on him, like the power of one? How is this all affecting?
Sure. It's a good question. I hadn't really had people ask that about, and honestly, like toward the beginning of it, I had to sit back and say, okay, like, babe, how are you doing? Because like, you don't think about it, at first. And it seems like, oh yeah, like, you always talk about how you're doing with it. But I was like, how is this fertility journey affecting you?
Yeah.
And I really tried to involve him in these conversations. He did not get a fertility coach. I like drug him to a therapist with me, even though like he's like, we're not having any problems. Like, why, like, and I was like, I don't know, like if I just needed a therapist to tell us, that we're good, like for me to like check a box or something. But like, I felt like I needed that validation that like, I was doing all the things that like I needed to do. I don't know. Like that's maybe why. And honestly, like I think the therapist got sick of us because she was just like, okay, like I deal with married couples all the time and like y'all are good. And I was like, but are you sure? Like it's like, are we doing? She's like, you guys do all the and honestly, this was the one thing that I feel like maybe this is why, we had her, is she validated me. And she told me that, okay, like, so for instance, she told me this, and I didn't know this before, is that, like strong couples or whatever, like whatever you want to define. And maybe you give this to your advice to your couples that you coach, is like, if you have 3 things you do during a day that are routines that you already have set up in your daily life to have with them, then you're good. And I was like, okay, what does that mean? So I started thinking about it. I was like, well, every morning, my husband either makes me matcha, because I drink matcha in the morning, not coffee. It used to be coffee.
Yeah, I saw that on your Instagram.
Yeah. So he makes me matcha. We like have an intentional hug like every single morning. And then we have a midday check-in. Just like if I don't talk to him within the first part of the day, there's always a time where we check in with each other and say, "Hey, how's your day going? What are you doing today? Have you seen a patient or whatever? Like have you talked to anybody who he's going to ask about this podcast? Later." And then like a sort of a bedtime routine. So, and we say our prayers and we read a little bit of this devotional book every night together. And if I am away doing locums, I'll either take pictures of the parts of the book that I'm going to be gone with, or he'll read it.
Wow. And that's more than 3 things. You checked off like 5 things right there.
Well, that's our 3 things that we do.
Matcha, intentional hug, midday check-in, bedtime routine. Yeah.
Okay, fine. That's more. So I don't know. And then, like, I know, like, maybe it's because we don't have kids, we don't have a dog. We don't have, like, we don't have a lot of other, commitments or, like we have a big friend group and, we do a lot of things with that. But, like I honestly feel like maybe when we have kids, like it's going to be harder to do. But since we've set up those intentional practices and those daily habits before all this happens, like how much better is that going to be for our kids to see?
Right. No, that's exactly it, Chrissy, because a lot of people, they just think it's going to be the same, or they think they're going to find a way, or they think that they're just going to suffer through the years. Like, I'm just going to be these are going to be the survival years instead of being intentional. No, we might not be able to have, he might not be able to make me matcha every morning because he might be flying out the door with the baby to the daycare or whatever, the toddler. But you'll find something else. Like you'll reevaluate and you'll be like, or you'll decide he's going to wake up 15 minutes early to make you your matcha. Like you will figure it out because it's so important.
Right.
Relationship.
Right. And so back to your original question about like, what else have I done for him? Like I feel like he's become, a part of the enlightenment, the awakeness that I've had too, because I share a lot with him, I share with him, and I think, like it's just, everything I learn, like I'll like run it by him. I'll be like, hey, like I listened to the podcast today and I heard this really cool thing that, I listened to a lot of Eckhart Tolle, and I just feel like Eckhart Tolle has opened my eyes to so many different things. And he gives it a good way to explain it. And I specifically like the way Eckhart has his dialogues in his book and his podcast, because it's real life people asking questions.
Yeah. You know who lost Eckhart Tolle? Faryal Michaud from Physicians Living Intentionally.
Oh, really? Oh, yeah. I've seen. Yeah, I need to connect with her. But
what were you to say? I interrupted you.
Oh, yeah, no. I was just saying, like, it's just I'll use those examples whenever I just for instance, the other day I was talking about, and I think this is very true. And, he talks about the power of now. Mm-hmm. And, there's so many people these days that want to escape the now, and we don't want to focus on what's in front of us. And people get, and we see this in the common culture, is that people get addicted to things like travel or hiking or dangerous things, or, motorcycles, or, race cars, or, skydiving, whatever you can think of that's somewhat dangerous. And, or even just like something that takes your attention. Well, they do those things and they're so addicting because they help you to stop thinking of the past and the future. They make you stay present.
What? Am I addicted to travel, Chrissy? Is that mean I'm...
I was thinking that too. I thought about too. I was like, Eckhart, are you talking to me? I was like, are you talking to me?
Yes, because I'm thinking about the future instead of just the present. Yeah,
exactly. But he does say, and this is what I agree with too, it helps you to get to that point. Mm-hmm. It helps you to get out of your head of thinking of that past and the future, and it helps you to stay in that present moment. So whatever you have to do to get yourself, some people meditate. I meditate a ton every morning.
Yeah.
I'm in meditation and journaling for at least an hour every morning.
Okay. I did it for about 30 minutes and I almost fell asleep during it, but I did attempt in my meditation.
Yeah.
Practices.
And I mean, some people like to travel. Some people do like to, do these dangerous activities, whatever.
Yeah.
Whatever gets you to stop thinking of all these fear, because ultimately fear is a story we tell ourselves based on experiences from the past. Whatever gets us out of fear and gets us out of worry of thinking about the future and keeps us in the present, whatever practice we're doing, we need to keep doing it until we can do it naturally on a day-to-day basis more frequently. Mm-hmm. And that's when I feel like travel will lose its thrill for us. That's what I truly believe. And actually, someone posted that in one of the physician groups recently. I can't remember which one it was. It was like, if you were given, X amount of dollars or all this free time, what would you do? And some people are like, oh, I would travel, blah, blah. And this one person, I was like, wow, someone actually feels that way too.
Wow.
But in the meantime, girl, I mean, we're traveling every time I'm off, like I'm looking forward to my schedule where I'm working 8 days in a row and then we're off the rest of the month and we're about to go to Alaska. We're like doing all these trips. Yeah, I get it.
Oh, beautiful. Oh my gosh. I'm going to have to look into that because that's actually a new concept for me. I haven't heard of that one yet. Being addicted to travel to get away from the future or the now. But I travel for, like you told, like when you interviewed me for your podcast, right? I travel for the community, connection, love, growth.
Right. Yeah.
So I think maybe the reasons, but evaluating that all the same, I'm going to. Sure. I'm going to continue to meditate. But meditating is in the now, right? Or as you say, meditating is also avoiding the past, or is it?
No, meditating is living in the now.
Living in the now. Okay.
And it's important to, and some people, and Eckhart talks about this, is like, people don't have to meditate to live in the now. You don't have to. Like when you put on your shoes, when you wake up in the morning, are you taking a minute to say, look at my shoes? I'm tying them or I'm slipping them on. Let me see
Yeah.
how my feet feel. Like the bottom of my soles, are they sore? Do I feel like my body is feeling good? Am I, doing a body scan to kind of quickly check in to see how am I feeling at this moment? Or am I thinking, oh, well, I hope the traffic's not that bad. I hope I don't have to, do a difficult case. I hope I don't have to, talk about this patient at M&M because, I'm going to get, frustrated or tumor board or, whatever you're doing. Like, I hope no one judges me because I'm like presenting this and they don't agree with my plan and
Yep. Clutter. The
that's what we
mind
do.
clutter.
Yeah.
Okay, Chrissy. Well, this has been incredible. Thank you so much. I mean, this has been amazing. Where can people follow you if they want to hear more about cleaning up their lives, cleaning up their kitchen, the alternatives
Sure.
for plastic cutting boards and the oils and the plastics? Where can we find you?
Yeah. So you can follow me at Whole Body Optimism on Instagram. I'm on Facebook and I also have a podcast as well. So you can find me on those. Just Google it. Whole body, like your whole body
Yeah.
optimism. And that's where you'll find me. And you'll find me talking about fertility and about how you can clean up your mind, body, soul and all the little, good things that I bring with it and digital
Perfect.
courses as well.
Yes, and we're going to have a link to those in the show notes. So let's
Awesome.
just take a quick picture here before you leave. We're going to take a picture.
Oh, here, I want to do one too.
Smile. Okay. And any lasting words?
Here,
Any
this is
lasting
mine.
words? Oh, okay. I got my doggy here.
I love it.
Any lasting words of wisdom?
This is happening for you, not to you.
Amen, sister. Okay.
All right,
Okay,
awesome.
I gotta run. So thank you so
Okay,
much.
cool. I may have to send you a Dropbox link for this one because it might be too long for. All right, cool.
However you need to do it. Or you can share the Zoom. You can always go into your Zoom and share it directly in Zoom. But you might have, no, because that just gives me access to watching, not taking it. Yeah. So figure out what you need
Dropbox.
to do.
Yeah.
All okay.
Right,
I'll be in contact with you. I'll be messaging you.
Thank you so much.
Bye, Chris. Interview by Dr. Chrissy Guidry. Now, I love how Dr. Chrissy started out with like her whole path to coaching was because of clean. She just wanted to start cleaning up her diet, cleaning up her kitchen, cleaning up her habits. Some of that stuff was information to me. And her mindset, the wisdom when it comes to something as powerful as suffering, which let's review that. Number one, when you put meaning to suffering, your whole life changes. And what she meant by that is, of course, we're all going to experience some element of suffering in our lives. We're all going to experience pain. Pain is inevitable. But when we choose to suffer because of that pain for days, for months, for years, that's on us. That's why you see so many people who have something terrible happen in their life, come up with a cause or come up with a reason to advocate for whatever it was that happened, right? It might be a disease, it might be an accident, it might be some tragedy that nobody should ever experience. And then they advocate and it gives their whole life meaning. And they're no longer suffering. They're no longer solely focused on suffering. It's like their life has shifted to elevating others around them. And in doing so, they elevate themselves. So let's adopt that. Next time you find yourself suffering, turn it off, pause, be aware of it, allow yourselves to grieve, allow yourselves to feel the pain, the emotion, and then give it some purpose. What purpose could we give this? Oh, life will change. Number two, I love when she said, she asked us this question, Dr. Chrissy, why am I not choosing to thrive? Wow. Okay, so that implies that you are choosing not to thrive. What's the opposite of thrive? I often think the opposite of thrive is survive. When you're not thriving, you are just surviving. And maybe that's not completely opposite. Maybe the opposite of thriving would be dying. But that's what you said. Pause, look around. If you're not dying, maybe you're just surviving. What if you didn't have to survive? What if you could thrive? What's stopping you from thriving? Why are you not choosing to thrive? Ask yourself. Number 3, we all have the choice to be happy. And we all have the choice to be happy in our relationship. If you have decided you cannot be happy in the relationship you're in, this is your invitation to leave. If you do want to be happy in your current relationship because you love this person, you deeply care about this person, you're connected, you're invested, you've put so much time and energy into it, that's not a reason to stay. What energy and time you've spent, that's gone. Okay? But if you love this person, if you want to be with this person, have a routine. And something's just not going your way, have a routine. She said her therapist did this, 3 days, 3 things a day. And they can be the smallest thing. You wake up together and sit and have coffee for 5 minutes. You just send a quick text midday, picture of the dog if you work from home. And then bedtime, peck on the cheek, 5-minute cuddle session, 30-minute cuddle session. Whatever it is and whatever you've decided, if you check in with your spouse, your love, 3 times a day, you will be more connected than the majority of people in this world. And if you have enjoyed listening to this episode, please give us a 5-star review on wherever you listen to this podcast and share it with a friend. You have the potential to change somebody else's life, save somebody's relationship, save somebody from suffering even more. Share the podcast, rate us, and continue to be in our lives. So much love to you and your family.